I'd start with a incident that happened, which I think was one of the triggers that pushed me from being the doctor to the political doctor, which my mum calls me. And this was a couple of years ago in a hospital not too far away from here, and there was a gentleman in his 40s. He was a cancer patient. He'd had chemotherapy. He was doing really well. He was recovering. And the consultant had done a ward round and found that he was having a temperature. So when you have chemotherapy, it can destroy your immune system, so it makes it more difficult for your body to fight infections like the rest of us. So the consultant said he's got a temperature, we need to give him antibiotics ASAP. Junior doctor was bleeped, so this junior doctor was on call, so she would have been covering about maybe 5 medical wards. That's over 100 patients or more. She logged onto the system, prescribed the antibiotics, and I think she probably either forgot or just didn't tick the box that would have notified the nurses to give the antibiotics straight away. So the antibiotics then got scheduled to be given in a few hours' time. Now what would normally happen in that situation, for those of you who work in the NHS, you'd know that the nurse would have saw it, would have bleeped the junior doctor, been very irritated and said prescribe this straight away. But on this day, there was a shortage of nurses on the ward. Not just that, but the nurses were not nurses that normally worked on that ward. They were not chemo nurses. And on top of that, there was not enough healthcare assistants on the ward. So the nurses were not only doing the medicines, but they were also having to clean the patient, take the patient to the toilet, etc. So it wasn't for a few hours later until one of the nurses noticed that this patient was getting this gentleman was getting more and more sick, hadn't had his antibiotics. At this point I was called, because I was working in critical care at the time. So when I went and saw this gentleman, it had been about 6 hours now since he should have had his antibiotics. He was very sick. We transferred him to ITU, but the next day he died. And I will never forget seeing his teenage sons come in the next day, because I knew that death shouldn't have happened. And of course, the junior doctor was blamed. She was, 4 months out of medical school. She would have to live with that for her whole career. And yes, she made a mistake, but the system failed this patient. And the system is being failed by an ideology that is systematically and deliberately undermining and eroding and dismantling our health service. And the reason why I tell you this now, because this is happening in every NHS trust across the country today. And we know what's happening, right? So A&E's closing, beds being cut, we are hemorrhaging staff, 100,000 vacancies across the NHS. Government policies are not only hurting patients, but patients are dying as a result of these policies. We know that this government is selling off our NHS to corporations, and often what's happening is corporations, and I've seen this in my own career, that corporations take over parts of the health service, often use the NHS logos. It's happening quite covertly. So actually even my colleagues don't know what's happening. And what's even been, that's not bad enough, what's even been more terrifying for me is, and the reason why I started this petition to keep the NHS out of a trade deal with Trump, with the US, is because opening up, having that trade deal with the US, and I know Johnson has said that the NHS is not for sale. We also know that Johnson is a liar. We know that the NHS is already being opened up. And to be honest, it is close to inevitable that our NHS won't form part of that trade deal, because our NHS has already been opened up to the market. And that was put in legislation by our good friends the Lib Dems in coalition. So our NHS is opened up to the market. It's going to be very difficult at the moment for our NHS to not be part of that trade deal. Number two, we know the power of the healthcare lobby in US, of big pharma, of the private corporations. A trade deal will not be get through Congress without access to our NHS. And thirdly, what terrifies me, which we think is why we need action really, really urgently, and why we're doing our current campaign, is if this trade deal happens, when Labour comes into government, it will be very difficult for then Labour to reverse the privatisation that's already happened to our NHS. And that's because international trade law, transnational law, Jonathan Ashworth has written quite a lot about this, and there's examples, I think, across Europe where this has happened. So not only very difficult, but it could also potentially cost us in government a lot of money to try and reverse that privatisation, because to make it simple, US corporations could then sue our government for potential loss of profits. So I think I've painted quite a bleak picture. The positive is, sign the petition, join the campaign. We're currently calling with We Own It, Keep Our Interests Public, and Global Justice, calling on legislation to protect our NHS by reversing the privatisation that's happened so we don't fall into that trade trap. And to continue on the positive vibe, I think I have painted what goes wrong in our NHS, but also our NHS. I am so proud and I feel absolutely privileged to work in our NHS.
Yeah.
I was working last night, and in our A&E we saw 500 patients came through our doors. 1 million patients go through the doors of the NHS every 36 hours in this country. Our NHS is socialism in action. Here, here, yes. And our NHS is a symbol, not just in this country, but globally, of the power and the potential of the socialised healthcare system. And the right like to tell us that public systems are bureaucratic, they waste money. Actually, if you look at the big international study, the Commonwealth study, our NHS is one of the most economically efficient healthcare systems in the world right now. Yeah, and secondly, I think the right or Daily Mail like to tell us how scared the British public are of socialism coming. Well, guess what? British public love our socialised healthcare system. In fact, 77% of the British public say that our NHS is crucial and integral part of British society. So we know that the NHS has, since its formation, has been an ideological battleground in this country. Now, the question I think we need to ask ourselves today is, why are we losing that battle? And why last year on the NHS birthday did half of the British public think the NHS would not exist in 70 years? And why is it that we have seen a shift in public discourse away from universalism, healthcare as a human right, towards this discourse of healthcare as a commodity, healthcare as a privilege, healthcare that some of us are entitled to? And that's, I've asked, put a few questions out there. I don't have time to answer all of them, but I think I'd like to focus on one area where that shift in discourse has happened, and I want us to think about why that's happened. So a couple of years ago, I was volunteering in a clinic in London that provided healthcare to those who can't access the NHS for whatever reason. And I remember this lady, she was in her 70s, she was the same age as my grandma, and she was from Uganda, like my grandma, and she'd lived here for about 10 years, not gotten to see a doctor because she was too scared of being deported. And her blood results had come back positive for syphilis. Now, syphilis is something, if treated quickly, it's really easily treatable, 1 dose of penicillin. But if left untreated, syphilis, it essentially goes into all your body systems, including your heart and your brain, and you get left with long-term cognitive psychiatric problems. So I was trying to work out from this lady through a translator when she had got the syphilis. And she told me that she was a lesbian. She had been found out in the community where she was living that she was been with another woman. She was subject to gang rape, and that's why she'd fled and probably how she'd got the syphilis. And I remember just how sick I felt at these policies that were preventing someone living in our streets from getting healthcare. And these policies are still in place. This was a couple of years ago now. They've actually got worse. And I think what we need, a few things that we need to think about here. Firstly, under this facade of health tourism, and it's an irony because actually our NHS was built on the backs of migrants and continues to be sustained today by migrants, but under this, this cover of xenophobia and anti-migrant sentiment that's been whipped up by successive governments, the government has managed to introduce charging mechanisms into our NHS, which are very costly, in fact, without not much uproar. And then aside, I think we had a sort of, I guess, a week of outrage of the Windrush, but those policies are still in place. How is it that my colleagues, and I think a lot of the British public, have now become quite comfortable with the idea that there's some people living in our streets who don't deserve healthcare? And then the final thing I want is just my last few lines now. I think we're very comfortable in this space about talking about healthcare as a human right. But I do think we need to start pushing further than that. So last night on my shift, I tell you about some of the patients I saw. So I had one elderly lady come in whose leg ulcers had become infected because of neglect. They weren't being cleaned properly. I had a young man come in and he had like a deep, quite wide cut down his cheek to his mouth. He wouldn't tell me who had done that cut. I had two young women come in. One of them was a teenager and she had tried to commit suicide. I had another young woman who was an alcoholic and was getting withdrawal symptoms. Two of my patients were homeless. So they all had access to healthcare. But the social and the economic system that they were living in had prevented them from their right to live a healthy and dignified life. So I think, for me, the fight for economic justice, fighting against policies that push the poorest and the vulnerable into poor health, the fight for environmental justice, where we are exploiting the world and people in the global south are dying, the fight for social justice, where people actually have decent, safe, healthy housing to live in. All these fights, the fight against the arms trade, all these fights are part of our health justice movement. They are not separate to that. They are an intrinsic part of it. And very finally, my last line, our NHS, the values it represents of solidarity, of fairness, of equality, of comradeship, these values are an integral part of our labour movement and core to it. So we cannot lose this fight. And I know we're up against it. We're up against the corporates and their profits and Big Pharma and the money that they're lining the think tanks and the politicians. But what we have is us. We have people with the same vision, and that is really powerful. So we can win this fight, and we will win this fight.